Thanks a lot for joining us here on KC2. This is a Purpose Rwanda show for a purposeful and addiction-free Rwanda. And I am Lavi Mutanganshuro. Today, we are going to discuss behavioral disorders, drugs, and alcohol addictions. And joining me today is Brother Kiyombo WANYEMBO Bienvenue. He's a registered clinical psychology specialist working at Ikizere Psychotherapeutic Center, a branch of Karais Ndera Neuropsychiatric Hospital. This center is specialized in treating both mental health and addiction problems. Thank you very much, Brother Bienvenue, for joining us.
A pleasure, Lavi.
And I think this is not your first time here on Purpose Rwanda.
It's not the first time.
Yes, thank you for honoring our invitation. And as I just said, we are going to discuss behavioral disorders, drugs, and alcohol addictions. And maybe as we start, let's start with the basics. How do you define behavioral disorders?
Well, before defining the disorder, as you know, mental health covers the whole range of well-being.
Yes.
Which means, what does behavior mean?
Yes.
A behavior is the response a person gives to a threat or to a particular situation.
Yes.
And this, the more it becomes a certain stable pattern and how repetitive it is or they define a personality of a person, of a human person. And so it becomes disorder when it has to do with it has to interfere with the normal functioning of a person in terms of self-image, interpersonal relationship, how the thoughts of the person is working, and how is he interpreting the environment, how is he relating to the environment, how easy or difficult it is for him to make to make stable relationship and to maintain them.
Yes.
How is he managing his emotions? And this can go to a range of from normality to abnormality. Yes.
And what are the common behavioral disorders that people can relate to?
Well, there are many of them, but I would rather summarize them in different personality styles or personality disorders and some mental problems. So you have behavioral disorders that are present in some personality disorders, because you need to know that all of us have personality traits, which are the repetitive patterns that help us relate and adapt to the environment. And so when it becomes a disorder, when there are some different signs, you know, how diffuse it is, how the ego is adapting to it, how is the person relating with the management of emotions and so on. And so you have disorders that are related to personality problems and disorders that are related to other mental problems like mood disorders, PTSDs, and psychotic disorders. So they come in terms of symptoms and signs that hinder the normal functioning of the person in the society.
Yes, you mentioned something on the symptoms. What are the symptoms that can show a person that they have this particular behavioral disorder? What are those symptoms? The common ones, of course.
Well, common ones are like difficulty in sleeping patterns. It's either you oversleep or you sleep less, overworking or not working at all. How you managing your emotions. There should always be a balance, you know, in the way we give our emotional response. How you relate with others. It's either you are too much attached or you're detached totally. You know, like isolating yourself. And how the person is looking at his self-image. Others see themselves like unworthy, while others try to boost their personalities as if they are almighty. And all these ways of responding, of relating to the environment is a response they give to a certain threat that most of the time comes from within. It comes from within based on our past experiences, our past trauma, our past experiences that most of the time our childhood experiences and different other experiences of life.
Does these disorders, behavioral disorders, affect one at a given age, or it can affect anyone at any age?
It can affect anyone at any age based on the cause,
Yes.
but likely present in children.
Oh, really?
Yes, likely present to develop in childhood. Why in childhood? Because you have some, during the developmental growth stages, different developmental stages,
yes.
there are critical stages, to put it simple, like from 0 to almost 6.
Yes.
If the kid has a proper care, it may likely lead him to a normal development.
Yes.
And then you have from 10, it depends on women or other
yes.
men,
Definitely.
from 10 to 17, 18, you know, puberty and adolescence. And so probably during these stages, there's likely to a person to develop behavioral problems linked to the type of care he receives. Yes. But there's one thing I want to underline is that development is not only based on the nature, yes. like the capacity a person has is what develops is developmental outcome. No, yes. It's an interaction between nature and yes. nurture and the environment, the care we receive. So you cannot, being intelligent is not enough for you to become a pilot. Yes. You need to go to school. So,
yes, definitely. Yeah. Yes, and still on this, since we've seen that it has to do with how a child develops, and this also has to do with parents. Do you have any message that you can give to parents who are following us right now so as to prevent such behavioral disorders?
The message I can give to parents is that we need to understand that most of parents, they do their best. Whatever they give as type of parenting style is yes. their best, what they know, yes. on the limit of their knowledge. But again, they should also have a humility and flexibility to understand that moments are changing, you know, yes. and they also need to adapt. You know, the development is not only at the personal level. Definitely. Even in a couple, a young couple which has kids should learn to behave as parents. So when a kid is 18, is different from when a kid is 5. Yeah. A parent of a kid who is married has to behave differently from a parent of a kid who still needs all full-time attention.
Yes, attention.
And when your children have kids, you become a grandparent. Yes. Parent. And so they need to learn and to follow some trainings in how to become good parents. Yes. Because they are already doing the best and out of goodwill, but sometimes they need to learn how to behave with kids at different stages
of life. Yes, thank you very much. And another question that one would ask, this show, of course, covers everything related to creating that purposeful Rwanda and, of course, addiction-free. Is there any relation between behavior disorders and drug and alcohol abuse? Is there any relation between the two?
Yes, there is a relation. Because as I told you, behaviors are responses people give. Yes. And these responses, most of the time, they may be called defense mechanisms or coping mechanisms yes. or adaptive mechanisms. But only that some can be maladaptive. And so there are some types of personalities which are kind of predisposed to develop certain types of behavior. Yes. And so the relationship between addiction and the behavioral disorders is on the type of, on a level of why a person is using the substance. Yes. You know, I want to clarify about two terms, the substance misuse and substance use, yes. Or drug use disorders. These, the difference is the why a person is using drug. The misuse is like using, you have a prescription from the hospital, yes. you need to cure your headache, they tell you to take 2 paracetamol, and you take 5, yes. thinking that it will give a different outcome. Yes. So that you're misusing. But the use of drug, the abuse of drug is when you use it for a certain purpose, like to maximize pleasure, yes. or to avoid facing a certain reality, or like a self-curing, yes. For a self-curing objective. And so this tends to develop a certain addiction. Yes. And so some types of behaviors, like the antisocial, who do not respect norms.
Yes.
Obsessive compulsive, who is out of his compulsion, out of his obsession, ideas, is doing compulsory activities. Borderline personality disorders, some narcissist personality disorders. These people tend to develop this type of behaviors of abusing drugs and other substances. That can be the explanation.
The relation between the two. And then having seen everything related, at least some of the things related to behavioral disorders, at which stage does someone know that since I'm having this symptom and that symptom, I have to seek for help, medical help, of course? At which stage? Does everyone who have these symptoms has to go to some centers to look for help, or there is a certain stage that one has to say that this is the right stage to go for treatment?
Well, you know, the human mind, the human person is made so that it can face challenges.
Yes.
And life is made of ups and downs.
Ups and downs, yes.
But there is a stage where you find that in all the areas of your life, you're struggling.
Yes.
You're struggling, let's say, in having enough rest. You're struggling in starting and finishing some work, some job. You're struggling in maintaining healthy relationships.
Yes.
You're struggling in managing your emotions. You're struggling in having a realistic self-image. It's either boosted or low.
Yes.
And so when you start having this struggle, instead of keep on isolating yourself for fear of the judgment of people or that people might discover that there's something going on, it's always good to speak to someone.
Yes.
To talk to someone who is not necessarily a professional.
Yes.
But this person might know which type of help to provide, maybe send you to a health facility. Of course, as I said, there is a range from normality to disorganization. When it's kind of really hindering and affecting the performance, or to put it in a simple way, the capacity of loving and working. Loving means being able to love and being able to receive love, to be loved.
To be loved. Yes.
Working is being able to work, give a good performance, but also to rest.
Yes.
And so if it's affecting these two areas, to make it simple, you really need help of a professional.
Yes. Speaking of help, let's take an example at where you're working.
Yes.
Which kind of support do you give to the people who come to you with these disorders? What kind of support do you give them?
There are different kinds of support, but I would rather go from the cause of these different problems.
Yes.
And you see people come from different problems. Some come from personality disorders. They are not managing how to cope with the environment.
Yes.
Becomes so difficult that they have to seek for help. Others come for mood disorders or psychotic disorders or traumatic disorders or anxiety disorders or addiction to different substances, drug or alcohol.
Yes.
And so each type of people have a particular type of care they receive.
Yes.
For someone who comes for addiction, for instance, there are different steps in treating them. So you have this detoxification.
Yes.
So you have to free the body. If there are any at any level that the product, the substance affected the body, and facing the withdrawal symptoms, because the person is so accro to the substance that when it stops, it can no longer function well. So the body is reacting, is craving for that. And so there is that stage. Then there is the rehabilitation stage, which includes psychoeducation about what are drugs and what are the consequences, what are the triggers. And while they're doing that, every patient tries to apply it to his own to his personal experience. And then there is the integration in the society. So this is the type of, but we are having we are limited a bit because we kind of offer all these assistance all together. And I spoke about the causes of the disorder. It's in mental health, we treat based on the type of causes.
Yes.
So the causes are multiple. It's a biopsychosocial model. I don't know whether you heard about that.
Yes, I heard about it.
And so the treatment should be based on this. So at the biological level, we need medication to work on the symptoms. And at the psychosocial level, we need probably a psychologist, a social worker, and an occupational therapist, but also to involve someone from the family.
Yes.
Because treatment does not end with being hospitalized. Once you're discharged,
you go back to the community.
Exactly. It's not the end of treatment. So there is all this process that goes up to 6 to some years, 6 months to some years of treatment being outside. And so, but we're lacking something. We're lacking what we call a halfway house.
Yes.
It's a house which is not a health center, nor a normal house. It's a house where people who have been discharged from our facilities can stay there and vacate to their normal occupation. If they are students, they go back to school. If they are workers, they go to work. And the challenges they're facing there, they come back to this house where they have peer support, and then 1 or 2 health professionals who are kind of guiding them. And then you have different types of disorders. Those who have personality disorders, for instance, they come on OPD or outpatient department, and they follow some sessions. They are given some medication if it's needed when it's affecting, probably they're having some symptoms. And then those who are hospitalized in mental health have also a certain type of treatment based on the symptoms, and then the rehabilitation and building probably the self-esteem, or teaching them how to manage in a healthy way their emotions.
Yes, thank you very much. And before we even go to the prevention part, because I always like to talk about the causes, talk about everything, but again come to the prevention part, because prevention, as it is said, prevention is always better than cure. But before we go to prevention, you've said that this treatment can go for months and even years. And maybe there is someone who is following us right now and they are struggling with a given behavioral disorder, and they are thinking that it's taking long. Not even behavioral disorder only, but also drug addiction. They are having a certain addiction. It may be drug, it may be any other thing that is addictive, and they think that it's taking long to end and break that chain. Which message can you give to them at the moment?
Yes, the message I may give to those people is that there is a word that comes to my mind. Psychiatrists normally use it. They say the delusion of reprieve. The delusion of reprieve is the delusion like a prisoner who is about to be executed has, to say, maybe at the last minute I'll be reprieved, they will change the idea. And so most of us think that death is about those who are dead. We know a potential candidate to death. And so that can be a type of delusion that a person developing these addictive behaviors may have. It's like, okay, you have a problem, you see that there is something not going well, but you say, okay, maybe it's not that. And what do? You hide. And so once you see that there is a problem in your performance, there is a problem in the way you perceive yourself, try to talk to someone. Surround yourself with people who can help you, who can listen to you, who can understand what you're going through without having fear of being judged. Because the more you keep on hiding, the worse it becomes. And when it becomes worse, it's like most of the time you receive people whose problems are somehow out of their own control. I was talking to a young boy who told me, listen, as he was telling the story, he said, when I started taking heroin, that was the beginning of my end. It was very, very touching, and I listened to him, but he's motivated to stop, and we are helping him. And so he starts we need to seek help. We need to speak about what is going on
Yes.
in our lives without having fear of being judged.
Yes.
And of course, to a person we trust, we do not open up to anyone.
everyone.
Yeah.
Yes.
So that's also a point I want to underline, and also to know that there are some authors who say a human being is made to maximize pleasure, to minimize pain.
Yes.
And sometimes we do that at the extreme. We do not have balance in life. Pleasure and pain make part of our human life.
Yes. That's life.
We do not need to be perfect.
Yes.
We just need to be ourselves. I had a mentor who always asked me at the end of the day, are you satisfied about your day, about what you did?
Yes.
No matter what you did, are you satisfied of that? And so learn that the real pleasure needs to come from within.
Yes.
And when it comes from within, it becomes happiness.
Yes.
But when it comes from outside pressure, it's just something that will not last.
Will not last.
And most of the time, you make someone was saying, drug became my friend, alcohol became my friend. Yeah, but a friend who is destroying you.
Yes,
slowly,
little by little. Slowly by slowly.
Yeah.
Yes.
That should not be a good friend, I guess.
Yes, it's not actually a friend, it's not even a friend. Then as we head to the conclusion, I would love to ask, is there any prevention to these issues that we've talked about? We've talked about behavioral disorders, we've talked about drug abuse, we've talked about alcohol abuse. Is there any prevention, like one by one? How can one prevent? I know people know how to prevent drugs, know how to prevent drug addiction, alcohol abuse and so on. But coming back to the behavioral disorders, is there any prevention method?
Well, it's a good question because you spoke about it's easy to prevent about drugs and alcohol and other substances, although it's not yet that successful. But to prevent behavioral disorders, we need to look at the type of environment our kids grow in.
Yes.
So because one of the causes is the toxic environment, like parents who are divorced, abusive parent.
Using abusive languages.
Exactly, abusive languages. The parent who is emotionally absent.
Yes.
Or the parent who is too much present. Because education is about the finding balance between the presence and the absence.
Yes.
There's a book, don't remember the author, which says, the no's that make grow.
Yes.
So you need to know when to say no to your kid and when to not to becoming too permissive.
Yes.
Or also to becoming too restrictive and too authoritarian.
Yes.
Because that is destroying the lives of our kids. Because a kid who has never been complimented by a parent, or any time he has to interact with the father is when he has reproaches and remarks to make. Or a kid whose parent has never restricted anything. And so, we know the world because behavior is also the type of response we give to the environment.
Yes, to the environmental situations.
As human beings, we know the world through our parents, who are the first environment we meet. And that's very significant because they kind of shape our life. We learn values through them.
Yes.
We learn to walk, we learn to work, we learn to take risk in life. We learn to be assertive and self-confident through them.
Yes.
And so we do not need perfect parents. All we need is good enough parents who are able to do their best, but also are flexible and open to dialogue. Most of the kids, I told you about the critical stages in developmental life.
Yes.
Most of the kids in these critical stages, especially adolescents, lack dialogue with their parents.
Yes.
There is a kind of conflict and this common saying that I say adolescents, a crisis is undergoing. Yeah, but there is no support, there is no presence and giving direction.
Yes.
That's why most of people who are into drugs and alcohol start it during their adolescence, when they are 12, 14, in school, under peer pressure, out of curiosity, how does it taste? and they keep on developing some dependence, and they are addicted.
Yes.
And it's only when it's too late that the parents come and intervene.
Yes.
Why do we have to wait until when it's too late? So the prevention is trying to restructure our family environment.
Yes, thank you very much, Brother Kiombo WANYEMBO. Bienvenue. That was very, very, very informative. And I think I learned a lot, and I think parents who've been following us now know their responsibility in ensuring that the children they have will not have these behavioral disorders. And of course, children who are already grown up, it's their responsibility to change some of these behavioral disorders. We are talking about also drug abuse and alcohol abuse. Try to seek help from your friend, as Bienvenue had said. Bienvenue, thank you very much for honoring our invitation, and it was good having you today.
The pleasure is mine, Lavi.
Yes.
And maybe one last thing. Maybe I will tell to the young people, it's true that we may blame our parents.
Yes.
But as I said, they are giving the best of themselves.
Yes.
What we need is, what are we doing? What are we feeding our minds with? Because that's the type of people we become. So let's make good use of our social medias and our time. Yeah. Thank you.
Yes, thank you very much, Brother Bienvenue, and thank you very much for your company. It was good having you. Just to remind you that Purpose Rwanda show, you can also find it on our YouTube channel, Purpose Rwanda. You can also follow us on our different social media platforms, Twitter, Facebook, and Instagram, reminding you that it's for a purposeful and addiction-free Rwanda. Until next time, I'm Lavi Mutanganshuro. Have a good night.